giving suboptimal advice, they can't easily get any sort of treatment, and they do what's strictly in front of them, which is sign a sick note, a note that has not been reformed since Lord George's time. The piece of paper which is our sick note is in fact something that dates back that long. You won't be able to think of many other things in the health service that haven't been reformed in the last 80 years. And there's no clear pathway of rehabilitation for work and work-related ill health. And work can be an important factor in people returning to health. And it is a fallacy to think that we all go to work every day 100% fit. But I've been inundated with requests from organisations that represent people with rheumatoid arthritis, diabetes, multiple sclerosis, migraine, etc., telling me that many of their members find being able to be in employment with appropriate adjustments by their employers essential to them feeling as near to normal as they can feel. Because actually when you have a chronic condition, and I can say this as someone who's looked after chronic disease for over 30 years, that what people want to do is to be as normal as possible. They don't want to feel they're different, they're excluded. So there's a great need for us to be able to enable people with ill health to feel, if they want to be in the workplace, that it's possible to be there. So my Fit for Work service is an attempt to take the current system from this rather chaotic, non-pathway, unhelpful system to something that would permit early intervention. And of course it needs a lot of working up. It is a high-level idea, although I have lots of ideas myself about how I would personally populate it. But I see it as a GP referral early on, when these conditions have not got chronic, into a service that is holistic, that acts rapidly, that isn't over-medicalised. Because what you often want is not a doctor in there. You often need some very good cognitive behavioural therapy, some really good physical therapy. You might even need some family counselling. There's a whole range of services. You might need the ergonomist. But my whole idea is that it would be rapid, helpful, and hopefully enable you to return to the workplace rapidly. And it's that which I really want the government to pilot. And I'd like them to pilot it in areas of the country where there is really deprivation and where all the problems of homelessness are maximally expressed. And the fact that it has now been referred to in 3 government reports in the last 3 months around the country pilot these Fit for Work services. So that was one of the central themes of the report. But in addition to making that useful, I asked that the sick note become an electronic note. It is a paper note at the moment. So today you have no idea how many sick notes are written in Bradford. You don't know whether they're written for back pain, neck pain, stress, depression. You wouldn't know where, your PCT wouldn't know where to target its resources, even if it had some to target. Because we've got no idea, we're absolutely evidence-free. Now that seems to me ridiculous in a world when collecting this sort of data would be just so easy. You could start Wales, the electronic note, to see how possible it is, and they're trialling that. And I think it's about 1,500 GPs in England are at the moment trialling a form of a fit note. I'm sure it's going to have to go through a lot of iterations. We won't get it right the first time, but those are 2 things that are very practical things from my report, which are ongoing work service. It brings me now to occupational health, because I see occupational health as much broader than the way it's been defined for years. It's been, I think, a rather narrow topic that's been confined often to the workplace. But I see occupational health as having a much broader vision than that, and therefore professionals within occupational health must be involved in that. And it is a great worry to me that occupational health is no longer a popular topic or subject with our doctors or indeed our nurses. And we are in a position at the moment that we cannot attract young doctors into this specialty. And the academic base in occupational medicine is at the moment on the decline. And that's something that we really have to do something about to change it. So, developing occupational health. I'm really, again, this is one of the things I feel extremely strongly about, that I didn't say it in my report, although I certainly thought a great deal about it. Why haven't we got a national service that is available to people rather than only available in a few places and often not in the industries we most need it in?